Professor.
Very good morning to you.
Good morning, Professor.
Hey, good morning, good morning.
Morning, Prof. Morning, Professor. How are you?
I'm fine, I'm fine. Good to see you.
Thank you. We're so happy to have you.
Yeah, thank you, thank you, thank you. Let me switch this thing off so that we should not be disturbed. Yes. So.
Okay. Sergio?
It's a privilege, Professor.
I'm fine, and you?
I'm okay. I was saying that it's a privilege.
Absolutely.
The honor is mine.
I share that privilege as well with Helena.
Thank you, thank you. Thank you. We have a heat wave. What of course for us is like winter.
Oh, really?
It is, yeah, it is 32, but everybody's complaining.
That's nothing for us.
Yeah, you know, Sudan 49.
Yes.
Okay. Good morning to everyone.
Good morning.
I'm Adrian Novunga, the ED of CDD, the Center for Democracy and Development. It's an honor to welcome you this morning to this webinar, COVID-19 Policy Choices in Africa. It's a timely event. Most of African countries have not yet reached to the peak of this pandemic, and yet some of the policy choices are already affecting freedoms, human rights to our communities in most of our countries. So this is the theme of this webinar today. I will hand over to Helena Márcia Chiquele. She's the head of programs with Oxfam in Mozambique. She's feminist, an activist for women's human rights, gender action learning facilitator, prevention of sexual exploitation, abuse and harassment, facilitator, and confidential counselor. I will hand over to you, Helena. Thank you so much.
Thank you so much, Adriano. It's a privilege to be amongst such an important and influential people. Thank you so much. Good morning and good afternoon and good evening to all of you, depending on where you are in the group right now. Thank you so much for joining us today in this important discussion. I think we can all agree that COVID-19 is currently the most dominant, most trending topic for debates across the globe. And rightfully so. The manner in which the pandemic has affected us all is not short of historic. We are living a new normal and we are learning how to behave and to fit the new reality. The reason why we are all holding this discussion without being in the same physical space, it's a living proof of that. It's a living proof that the rules of engagement are shifting. COVID-19 is also worsening the pre-existing negative phenomena. Are human rights across Africa an example of that? Today, we're going to be discussing COVID-19 policy choices in Africa, looking at the public safety and security and how they interact with limits of freedom. To walk us through this topic, we have a world-class panel comprised by a speaker and a discussant. Our speaker is Emeritus Professor Mohamed Salih, a Nobel Prize for Peace co-laureate awarded in 2007 to Intergovernmental Panel of Climate Change, the 4th assessment report on climate change. His latest book that was co-authored by Professor Will Oates, it's a political economy of Africa regionalism, an overview of asymmetrical development. Mohamed Salih is an emeritus professor in politics of development at Erasmus University, Rotterdam in the Netherlands. Thank you so much, Professor, for gracing us with your knowledge and your experience. Our discussant is Dr. Siphosami Malunga, Director of Open Society Initiative for Southern Africa, an organization that has human rights at the core of its mission. Thank you so much, Doctor, for accepting our invitation to be with us today, shedding your informed light into this topic. Dear participants, you'll also have your chance to say your piece in this important debate. When we open our Q&A session, you will be asked to be concise to allow as many participants as possible. Kindly use the chat box to share your comments and ask questions. And now, without any further ado, I will invite Professor Mohamed Salih to take the floor. Professor, you have 15 minutes. Thank you so much.
Thank you very much for your kind words and introduction. I want to start this webinar with reference to our host institution. That is the Center for Democracy and Development. COVID is very much related to this topic, at least in 3 ways. First, it is negative impact on development, as we see the economies of the continent are now down-rated in terms of growth. It is effect of human security and human well-being. This is a developmental issue, but also it is impact democracy and how people practice their democratic rights during times of COVID-19. With these short remarks, I want to remind our listeners that there is a tension, although unintended, between democracy and security, particularly when one is used to undermine the other. The question before us is a straightforward question. During the times of COVID, we see many governments, not only in Africa, many governments in the world have introduced measures. These measures, policy measures, are considered non-democratic and anti-libertarian, that they impact negatively on the liberty of the individual. There are 2 important camps. One camp says that the state must be given the resources and the mandate to protect citizen rights at those very difficult times because of the existential threat that this pandemic is posing. There is another group. It's not only in Africa. Probably you saw them yesterday in the United States when they have the 80th anniversary of the motor right, where citizens were assembled in big numbers, not observing any of the measures that were put there. We see it also in our own continent, where people try to venture out. But of course, there are different reasons why people try to venture out and why people try to undermine some of these policies. So in a sense, the question is, what comes first? Freedom or security? Is there a way that we can safeguard freedom and public safety or security in policies that are adapted to the socio-economic and environmental conditions of our people in Africa? The point that I want to make are as follows. The first point, there are a lot of commonalities between the policy measures used by some African governments in the case of COVID and security measures used by authoritarian regimes. The first one of these is as follows. There has been a very heavy-handed response, and we know that. So whether we live in the continent or out, the world now is global, as the first panelists had introduced this panel. We know, for instance, not only rights of assembly, sometimes for good causes, they were allowed in other countries. I live in the Netherlands. People are allowed to demonstrate. We know during the COVID, more than 10 elections have taken place in different parts of the world. Some governments say, no, you cannot have elections for certain reasons. This is the first point. The second point is that COVID also is used to undermine opposition groups to practice their rights under the name of COVID. In fact, the opposition, as I understand it, to the government policies is not against the safety or the public safety of citizens, but rather to come with a measured and well-adapted responses to the situation and to the case in Africa. The third point is that we notice that in some of our countries, citizens were prevented from going about their daily ways about how to go out and earn a living, particularly for those who live from hand to mouth. They are not people with very big savings. For instance, one would ask why, for instance, there was a system of grouping people in the marketplace, like 10 or 15, or even 20, so that if one person has COVID, then they know it is among that group, and that group, of course, some safety measures can be taken, like lockdown or tracing of those people. I mean, there are many other measures, but for some reason, our governments decided to do that. In countries, for instance, like Morocco, when the king decided to release political prisoners, to release prisoners generally, all prisoners to be released. Every prisoner is released except the political prisoners. So it means that COVID also is not, the measures that apply to every citizen does not apply to those who oppose the state. We see in what is happening in Uganda. It is one of the 4 least affected countries with COVID-19. Yet the policies, in fact, are the harshest, particularly when you come to the opposition. So the debate simply is, does the government, again, I just want to remind our listeners, does the government have the right to restrict the freedoms of citizens in those days by undertaking measures that are not adapted to the conditions of the country, or using those measures in order to stifle the democratic and human rights of citizens? My last point, I think, is obvious. My last point is that under these circumstances, how can civil society and NGOs and activist groups, as well as epistemic communities and institutions such as the Center for Development and Democracy, be able freely, without their critique being seen as an affront to the state policies, and can also even bring them under certain measures? Because some countries have introduced emergency. Some countries introduced emergency measures, used the military, it is very militarized operations. We saw that in Kenya before our own eyes. And in fact, in the process itself, some people have lost their lives. So the debate now is between the libertarian, who will say that under no conditions the state has the right to stifle the rights of citizens, and those who would say that under such circumstances, the state should be empowered to stifle these liberties. Of course, the libertarian's view is, in a sense, has some sense to it, because governments were never given special measures to deal with so-called existential or security concerns, and remained within the limits of those provisions. The states usually exceed any provision that's given to it to interfere in the citizens' space. Of course, in democratic societies, once the state starts interfering in the domain of individual citizens, regulating their lives in the heavy way that we saw without justification, that of course is affront to democracy and affront to the role of the state, which is to protect life, to protect property, and to do all of these under very, very major circumstances. So I think the debate for me is clear, because we live it every day. We know what's happened in our continent and other parts of the world, and it seems to me that the states is somehow oblivious to the debate. Because for me, I am not 100% sure how many African parliaments, for instance, because of course in any democracy, any policy that affect all the citizens in a particular country should be legislated. And the only institution that comes with such a legislation is a parliament. Of course, some governments came with all different types of dodgy response to that, for instance, by saying, oh, parliament cannot convene because of COVID. But we know that parliaments are convening the same way we are convening now in different parts of the world. So in some areas, unfortunately, we see policies that could be well intended to save citizens' lives under this existential threat that we are facing throughout the world. But at the same time, we find that the policy responses did not include the legislations that would allow the state to be able to introduce these measures. In fact, the biggest fear from most of us is that probably some of these policies will continue even after COVID has left, because it is a reminder to our citizens of the days of authoritarian regimes, whereby the state takes decisions without proper consultations through citizens forums or through even parliaments or national assemblies that represent the people. So the concern, we understand it. Our panelists just introduced the subject by saying how this COVID is a threat, is existential, it threatens people's life at a wider space globally. We understand that, but we do not understand why a well-intended policy have been misused or abused for what it is really intended for. I think I stop here. Thank you very much.
Thank you so much, Professor, for this. Finding the right balance between freedom and security. And something else that you said that I think we should reiterate: policy measures used by African governments of Africa in context of COVID are similar to those used by authoritarian regimes. I'll not steal the thunder from Dr. Siphosami Malunga. So I'll ask him to please take the floor now, Dr. Siphosami Malunga, and do your what we expect from you. Thank you so much.
Thank you, Helena. Thank you so much, Professor. It's really an honor to walk in your shoes. I don't even think I can walk in your shoes. Maybe I have to carry them. Professor, you have just unpacked a conundrum. I should thank Professor Adriano. Thank you so much, my brother, for inviting me to this. And we are really proud of the work CDD does. We continue to be proud. We know you're at the forefront of defending democracy, not just in Mozambique, but in the region. And we are happy and pleased to stand with you. You know, one of the things we tend to forget, and Professor, you've laid the issues so clearly. This is a tension between two very important demands. One would even call it a moral dilemma. A moral dilemma. You know, what do you do? Both of these things are good and important and necessary, but sometimes they cannot coexist. Not all good things go together, they say. You know, not all good things go together. But how do you make things go together if you need them at the same time? One of the things we never discuss when we talk about this topic is that we went into COVID already with a huge deficit of trust between the citizen and our governments, especially in Africa. We tend to forget this. We make an assumption that the trust was eroded when the measures were introduced. This is not the case. Our people have always mistrusted government because they have always been mistreated by our governments. So nobody wants to die. Let us be clear about this. Even I know our people are brave. In history, they fought off the white colonialists, but we are all afraid. We run away when we see a snake in the village. We don't wait for the snake to bite us. Now, what does this mean? Everybody was clear as soon as they understood that this thing could kill them, that they needed to do something about it. They may not have understood what it is they need to do, or they may not have known or had the tools to do what was required to do. But in reality, people are not suicidal. Let us accept this. People are not out there doing a kamikaze, trying to kill themselves. You know, saying, I don't care, COVID can kill me. These are moral choices, tough choices that people find themselves having to make. But when COVID came, our governments were already abusive of our citizens. You can go anywhere. Start with Mozambique, stealing $2 billion, abusing people, human rights violations. We go to Malawi, stealing elections, holding on, being this Peter Mutharika. So even before COVID came, the man was already abusing, stealing elections, harassing his people, arresting human rights defenders. Go to Zimbabwe. This military junta, this coup regime, had been abusing people, killing protesters, abducting people left, right, and center. So now COVID comes. And COVID, I always say, became the golden goose for these regimes. It was a golden goose that lays the golden egg. They were waiting. It's almost as if they were waiting and praying for COVID, these authoritarian regimes, because then COVID gave them the ultimate excuse to really finish our people. You know, I speak from experience. I've lost a few relatives and friends, close friends to COVID. And 90% of the times that I've lost those people, they have not been killed by COVID. I know they have COVID, but they have been killed by failed health systems, terrible infrastructure, poor investments. And I say to myself, what gives someone the moral authority to tell me to sit at home, do nothing, not protest, not complain, when they know that they have put me in this grave and mortal danger? I cannot speak. When I speak now, they want to send the police. Now they send the military. And whenever there's a little money that comes for COVID, they steal it. Go anywhere, look, Zimbabwe, Mozambique, South Africa, Nigeria, they are stealing COVID money. And they're telling people to sit at home and be safe and follow the regulations of COVID. So I'm going to sit at home for what? Why should I sit at home when you are not doing what you are doing? So for me, the first point, as I said, is the trust deficit. We went into COVID without trust. We went into COVID without any good faith by our rulers or our governments. So we must unpack this point. It did not help, which is my second point, that our governments were telling us, do as I say, not as I do. What did we see in many countries? Did they even respect COVID regulations themselves? No. So you see governments having rallies. You see them having their meetings. You see them not respecting social distance. You see them do all the things they are telling the people that they must do. And why should people accept this? Because there is clearly bad faith. We know, and there's a saying, I used to work in the justice system for many years, that a prison works not because of the chains and the locks. A prison works properly because prisoners cooperate. That's why and how a prison works. Is because prisoners cooperate, because they are in a prison and they agree and accept their situation and they agree to make everything work. So how do you tell people to lock away when they have no food? You are stealing money from the drought relief. You are not even going there to give them the food. You are telling them, no, stay there because the rules say this. That's the second point I wanted to say. That people watch what governments do and they disbelieve the necessity of these regulations. They disbelieve the necessity of these public safety and security arguments. This public health safety, and they say, well, if it really killed, why are they doing it? Why are they out there having their rallies? The first lady in Zimbabwe is going around giving people food, calling old people together, hundreds of people. When the regulations are clear, only 50 people can assemble. Even funerals are banned, but she's everywhere going around giving people little useless things. So people say, we don't believe you. If it really was serious, you wouldn't be doing it. Why is the ruling party having rallies in the middle of COVID when the opposition is not allowed to do so? People then say, wait a minute, this is not about COVID. This is about something else entirely. The third thing, and Professor, you captured this very well, and I appreciated the point that the moral dilemma about people is, we all, I said earlier, not just in Africa, we're all afraid of dying. But let us accept that we also have a choice in how we die. Ultimately, we have a choice. So there is this concept that if I die, I die. There is absolutely no way
I think we have lost Dr. Siphosami.
Yeah.
Dr. Malunga?
I am here, but he is here.
He's here, but I think he's...
Siphosami, I don't see him.
Yeah. Okay.
Big Brother is watching or not?
I hope not. There is a maybe.
Can you hear?
Oh, yes, he's back. Thank you, God.
Now you are back.
I had lost you a bit. So I was saying, which is the second last point I wanted to make. There is no way we can expect our citizens to sit at home without food, without money, without jobs, and wait and avoid a virus when the immediate need is for food. It's impossible. It is completely impossible. So we have to understand and accept that we are placing people in a very invidious and impossible situation. It is not even a choice to negate or to ignore COVID restrictions or to risk their lives. It is a choice to save their lives by going out to look for food. There is not even a dilemma here. We are not saying to people, so the expectation is a foolish and false one that our governments can have. So we have to put this blame again on our governments, because it is the responsibility of government to make sure that whatever measures it puts, the people are not prejudiced by those measures. One last thing I wanted to say. We also have some guidelines, so to speak, or some norms which need to be followed when one is looking at restricting human rights, the operation of human rights, the Syracusa Principles. And they are clear. They say whatever you do has to be legal. In other words, constitutional to the extent possible. Whatever you do has to be based on evidence. Whatever you do has to be proportional. Whatever you do has to be gradual. What have we seen with COVID implementation? A lot of the things are not legal at all. A lot of the decisions are not legal. You start to say people cannot share things on social media during COVID. Or if you share something that is false, we will arrest you. What nonsense is this? When the governments are the #1 purveyors of false and fake news. They want a monopoly on sharing false news during COVID. They want to lie to us about COVID. They lie to us about the number of people that are tested. They lie to us about how much COVID has infiltrated our communities. So they don't want people to expose these lies. When people expose lies even about COVID procurement, when people expose lies about corruption, then those people are attacked, like in Zimbabwe, where we have a journalist right now for 2 weeks languishing in maximum prison because Hopol Chingono languishing in prison because he exposed high-level corruption by including from the president's office of 60 million COVID funds. So you can understand what's actually happening here, that a lot of the things are being done to stifle free speech, to stifle, and they're not necessary, they're not even legal. The second part of evidence-based, we have in other countries indefinite lockdown. Okay. How did you arrive at indefinite? Because the virus has been tracked over weeks. We know, we are told every day. The science is precise. We are told today there were 200 infections. How do you move from clear 200 infections to an indefinite extension of lockdown? Before, the lockdowns were clear, 2 weeks, 1 month. So, and then we're now, so you begin now to have, it's a free hand, right? If it's indefinite, you don't know when it's going to end. So it's not even evidence-based. You are not even being told that the extension is related to the curve. We don't even know our curves. If I ask you, Adriano, what's your curve in Mozambique? What's the curve of COVID in Mozambique? You don't even know. You are just told that no, things are now serious. So we now must extend the extension indefinitely. And of course, proportionality. I've already hinted a little bit about this. Is it necessary to send an entire army into the neighborhoods, the quiet neighborhoods, quiet, peaceful neighborhoods of our citizens? Why are armies walking around in those citizens with whips? Is this proportional? Are we still fighting COVID, or are we fighting the people? And the last thing, gradualism. You just hear, it's not even gradual, these measures. It's just a pile of them. You don't do this, you don't do this, you don't do this. You can see that they have been waiting. These authoritarians have been waiting, and COVID has been a godsend to them. Now, my last point is, what do people do? And I asked Professor this dilemma. I've already said people believe some do or die. Do you sit back in the face of injustice? Do you simply say, I will wait indefinitely? Because many of the lockdowns are indefinite. So for many of our people, if they are waiting until COVID is finished, they may wait for 2 years before they are able to express themselves and complain about the conditions in which they live. That is completely unacceptable. It remains the people's choice to choose the way they die. I'm sorry I have to say this. It remains the people's choice to choose whether they will die from COVID or they will die removing an authority that is exposing them to mortal danger in the way it mismanages COVID, in the way it abuses them, in the way in which, so it's hard and a moral choice, but the individual must also make his own choice. It's a fight or flight situation. If I'm not allowed even to just protest, to say I'm hungry, you can't stop me from saying I'm hungry, because 6 months down the line or a year down the line, when COVID is finished, me and my family will all be dead from hunger, not from COVID. So I'll stop there, and then I will come back later if I have others. But thank you so much, Prof. You unpacked the moral dilemma so well. Those are that's my reply in very few words about where we seem to be. Thank you.
Thank you, Dr. Malunga. Passionate indeed. I'm sorry to hear that you have lost loved ones to COVID. A sad situation indeed for all. I have here some points basically on the chat box of agreement, especially saying on the specific needs of specific attention should be given to those who with special needs. If that was not the case, that's one of the things that is wrong with all the measures. Also agreeing with the points by Professor saying COVID has exposure, well, by Dr. Malunga saying COVID has exposure, our weakness is a continent. We don't have basic condition, talking about health. Also saying that democracy in Africa is a myth, and we expect to be quiet and prisoners of our identities. And also one point about if you don't do what the government says, you are appointed as an enemy, also agreeing with some of the points that were made here by the panelists. We have a question that is general. What can be done in case where police are being abusive during this time, especially to those in suburbs? Because in some countries, this pandemic has been a source of making extra money for the police agents, so police officers. So maybe before we get more questions, I'll hear from you, both of you, on this question, because this is the only question we got so far on the chat box. Thank you.
Siphosami? You want to come in, Doctor?
No, please, you start, Prof. I'll come after you.
Okay, first of all, I would like to, I know there is a question to be answered, but before doing that, I would like to thank you for your, for the discourse that you have just shared with us, which I agree with. I think there are 3 points that you made, and they were very helpful in making the presentation very clear. And one of them is that COVID-19 is now used as a control measure. And it is under the cover of that control measure, the authoritarian nature of the African states became very clear. It is revealed through COVID. The second point that, in fact, you say whether intentionally or unintentionally, but in your case it is intentional, our states have mistaken our people for being the enemy. They were attacking the people and not COVID. As you can see very clearly, these militarized operations going to peaceful neighborhoods, harassing and whipping people. So in fact, for them, the enemy is not COVID. The enemy is the people, because they were not attacking COVID with the right policies that would help and assist people to cope with it. And the third point that I really like very much from from your intervention is that, and also you posed it as a question, what should citizens do? In my view, the type of discussion that we have today, whenever a government securitizes an issue, it becomes in the minds of the policymakers a security issue. The response from the people is to democratize the issue, to come with it has to be a dialectic between those who securitize the issue and those who democratize the issue. Because once an issue became a democratic issue, there will be an opening for citizens through their representatives, through the coming elections, to take that issue as not as order. It is not as control and order, but to see it is really an issue of an existential issue that is related to democracy. We go back to the old cliches that we hear, that famines don't take place in democratic societies. Why? That is Amartya Sen, the Nobel Prize winner in economics. Why? Because citizens have the possibility of discussing these things, and for trying to force government in order to do something about it. But the more it is securitized, the more it is taken away from the people to the hands of the security organs and the intelligence and all of that. So the issue, they securitize, we democratize. And we look at issues of human rights. And the third point that you have mentioned is that the states took this, or have all states have the tendency of using crises to come with a narrative that suits their possibility of expanding their existence and their expanding their holding of power. And that is something, because also you have to look at COVID not only just as a disease or an issue of public health, which it is, but also it's an issue of law, issue of politics, issue of food security, issue of democracy, issue of how we organize ourselves. It is also an environmental issue, because our environment in this modern age is occupied by a virus. The environment is occupied. It is on the air. It's occupied by a virus. And that creates a dilemma. It is a creation of this modernity, but at the same time, we depend on modernity in order to combat it. You see, today they say there is 23 vaccines are on trial, different stages. 139 just being developed. They have not yet reached the trial period. So there is what you call a bewitchment of reason. Reason has been bewitched in a sense that the very source of the disease and of the crisis is seen, in fact, as a solution to it. And you are not sure whether you're getting more of the same or less. This point is important. Why? Because the state rides on the discourse of modernity. They think that they bring policies being adopted from somewhere else that is modern, they are also modern. They bring this modern, because COVID became a representation of modernity. And if you take these measures wholesome, you are also modern wholesome. Regardless of how human rights are abused, how people can stay in their houses without food, how this, how that, without even provisioning. We heard that the American government last time gave people $600 a month, and now they are giving $400, and everybody is crying. And of course, the libertarians are against it, and so on and so on and so forth. So you see, there are linkages. There are linkages, and we have to look at these linkages. And this immediately come to the chair of our panel. She asked, what should citizens do? The issue should go out from the narrow definition of COVID as a matter of health and medicine to an issue of rights, an issue of democratic rights, an issue that is political to the core, and it has to be discussed from a political lens. Because it is politics. From the day when it came out, it became politics. Some people call it China thing, all politics. So please let us not be blinded by saying, oh, this is something that is high up, you don't understand it, you know, it is medical. The laboratory said, and the laboratory said that, and how is infection and all of that. No. Every issue that affects citizens is a democratic issue where people should be able to discuss. And I think this is one of the roles that the Center of Democracy and Development should guide citizens and activists like yourself, intensify the talk about the democratic nature of COVID-19. Thank you.
Thank you
so much, Professor.
Thank you.
Yes, please, Dr. Malunga. Thank you so much, Professor.
I completely agree with you that COVID is not a medical crisis. It is to a certain extent, but it is really essentially a crisis of everything. It's a crisis. It's a crisis of power. It's a crisis of inequality in our societies. This is the point I started with. When I say COVID came and found a huge hole in our trust. There was a huge trust deficit. And you find that countries that were able to have governments work very closely and amicably with citizens in addressing COVID are ones that had more trust already. Are governments that were not authoritarian, that were democratic, that were delivering social goods already, that had invested made huge investments in healthcare, that listened to citizens, that respected already the rights of citizens to speak and protest and question, that had systems of full multi-partyism. You find that in those countries, and I'm sure a study has yet to be done, you find those countries dealt with COVID better because the trust existed and citizens knew that the government had good faith. Whether it is New Zealand, Germany, there are some countries, we know them, the ones that are led by women actually. It's also a fact that all those countries that have dealt better with COVID are the countries that are led by women. I have to say this, it's important to say this. So I completely agree, Prof, that as long as we now recognize that it is no longer just about COVID, we must refuse to allow our governments to make it just about COVID.
Refuse it.
Our governments continue to tell us to stay at home, wash our hands, wear our mask, and do nothing else, while they assault our freedoms, beat us on the streets, send soldiers on us, steal our money meant for us for COVID, kill our people. Is not acceptable. We're not going to sit and accept it. We are going to address the issues that came with COVID. And the issues that came with COVID are corruption, abuse, illegality, constitutional reversals, and all the nonsense that the governments took advantage of with COVID. We're not going to just limit ourselves to just dealing with COVID when we know that COVID is now a proxy. It's a proxy for so many things. It's obviously a proxy also for pharmaceutical companies in America. They are salivating, thinking they are going to make billions. We know all this. And we are going to take the fight against big pharmaceuticals as well in COVID. We know what's going on. We know that COVID has also become a proxy for China versus America. We all know this. We see what's going on. It's no longer just about COVID. So, but for us as people, we need to fight COVID in the way it affects us. And I agree with you, Professor, that it is not just a medical crisis. It's not just a medical pandemic. And we must fight back to preserve whatever democratic and civic space our people need. Because if they don't, we have to understand what's going to happen. With every day that passes, with authoritarian entrenchment, using COVID, by the time we are finished, we are going to be finished. By the time COVID is finished with us, our governments will be finished with us also. If we don't push back at every instance and every effort in the attempt to unnecessarily close our democratic space, and I'm saying unnecessarily, because it is possible to protest with COVID. I can stand here with my mask. I can have a protest during COVID. Who says that COVID means that people should sit at home and not protest? We know social distancing. I can stand here with my mask and Adriano can stand over there with his mask. And Professor can stand over there with his mask. 50 of us, then we protest for 2 hours, then we go home. We have respected COVID. We have expressed ourselves. It's our right. We have been able to balance those demands. We can't say, oh, now we'll never demand our right to protest because it's during COVID. We have to say, what does a protest under COVID look like? What does an election under COVID look like? We can't say there can be no elections under COVID. No, it's unacceptable. Because it means that what if COVID is with us for 4 years? What about all those governments whose tenure is finishing? So that's the push for citizens. I asked the question, I'm answering it again, adding to your answer, Prof. That the debate must be, how do you respect human rights? How do you advance democracy under COVID? That should be the constant question. And anything that is done by authorities and authoritarians must be subjected to the test. Is this consistent to the spirit and letter of constitutionalism and human rights? If it is not, how should the needle be moved How should it be pushed closer and as close as possible? Only what is necessary should be restricted, and absolutely necessary, but also within the confines of human rights. Thank you so much.
Thank you, Dr. Malunga. How to respect human rights in the context of COVID, how to uphold women's rights in the context of COVID. Forward-thinking countries and progressive countries have dealt better with COVID-19. So this is itself a topic for another webinar, but it's good that it's mentioned here. Policies must tackle COVID, not people. We should also open up this discussion instead of focusing on being a public health related discussion. It should be a rights discussion. We should democratize this discussion. We have a couple of questions here for you. And yes, Adriano, I see your hand, but let me just list the questions before I give you the floor. So just one of them is just, can we say that COVID has been a miracle that government has prayed for accelerate the corruption? This is something that we at some point it was mentioned, but not in these the exactly words. The other question is, should government seek external help to overcome this pandemic? And the next question is, should the agenda of government change because of COVID, because we are still longing for promises they made? And the fourth question is, how do we fight back against government repressive ways of operating? Dr. Malunga, I have came to realize that those countries led by women are really tiny, except Germany. Does it really have to do with gender or population? This is a provocation for you, Dr. Malunga. Like I said, a whole topic for another webinar. Why can't we protect? Black Lives Matter protests are passive. They were broadcasting and they respected social distance. Why can't we show the world of all of this? This is our time to stand for our one. So this is also in agreement to what was said by both of you, Dr. Malunga and Professor Mohamed. So I will first give the floor to Adriano, and then I'll come back to with Professor and then Dr. Malunga before we get some other questions. Thank you.
Thank you so much, Helena. Thank you very much, Professor. Thank you very much, my brother Malunga. This is really to give a bit of Mozambican context as a way of showing how right you are in your take in this nexus between securitization and democratization, and the pandemic being used by governments to all sorts of evil agendas. I think the COVID-19 has given evidence of how captured our democracies are. How captured our democracies are, with different manifestations, but it is the same phenomenon, captured democracies. Mozambique, it has a particular manifestation, Zimbabwe, South Africa, and so on and so forth. We have been talking much about state capture, more linked to policy capture in the framework of corruption. But what we see now happening in the way that governments have responded to COVID-19, it is really more the capture of democracy itself, the instruments of democracy itself. You look at what is happening here in Mozambique. I mean, Helena is absolutely right in saying that they seem to have been praying for a disaster of this magnitude to happen, to give them the means to go outside, quickly borrowing the money that they needed to divert their pockets, which is exactly what is happening. 1 month after COVID, even before a proper national discussion was held, even before putting in place the necessary institutions to address and assess and see how a proper take of what was happening, what was in place, they rushed to Washington to ask an IMF loan. That's big money, 309 million. They mobilized society to go borrowing this money. They came back, they went silent. And immediately they approved the state of emergency to limit the possibilities of the people to manifest, to limit the possibilities of people to freely agitate in a democratic dispensation. And a lot of measures were being put in place aimed at securitizing Mozambique in the context of COVID, but they went silent. And we were expecting government to put in place safety basket nets for the people, to give some cash for the people. They were silent. They were silent. They kept on repeating the state of emergency until last week, when we learned that all the money is now gone. All the money is now gone. So this state of emergency, it was an instrument they needed to distribute the money amongst themselves without tendering. It was not meant to stop the people from going out, but it was more really to make sure that they had the legal instruments to distribute the money amongst themselves without tendering, without the possibility of people asking. In fact, in the context of a state of emergency, they can take all kinds of decisions with the money, and there will not be a room, a space for people to ask to use ordinary laws to demand information. We were taken by shock when, at the end of the possibility of the extension of the state of emergency, then they found another ways of reinstating another state of emergency, rather than using a soft, ordinary calamity law, which is out there. But it's simply because in the context of that ordinary law, they had to do proper procurement to award the contracts to friends. So with another state of emergency, that would give them the instruments to keep distributing the money amongst themselves. So the state of emergency, it was the instrument they needed, the legal instrument they needed to legalize corruption, so to say. To legalize corruption, so to say. So this is more than a captured state. It's a whole democracy that is captured. That is captured. So you can do anything, even if the constitution is there, and clearly it does not foresee this repeated state of emergency. But you will find ways of putting in place all the instruments, legal instruments you need in order to allow for a certain outcome. This is where we are sitting today, and we're asking the information. I mean, how can you spend in 3 months How can you spend $500 million in 3 months? The economy is halted still everywhere. How can you? What are these contracts for? Where can you procure things? The economy is paralyzed. There's no business everywhere, but you managed to find space of giving contracts of $500 million. This is 20% of Mozambique's annual budget in 3 months. This is scandalous. This is scandalous. So the extension of the state of emergency, which clearly limits the possibilities and freedoms for people, but more than that, it is the instrument they needed to distribute this money without being questioned. I just wanted to make to give a Mozambique perspective on what is happening. So my point really is that we are in a situation of a captured democracy. It's a clearly captured democracy. Thank you, Helena.
Thank you so much, Adriano, for your points. First, Professor.
Yeah. I think that first of all, they have about 4 questions, and I see some of these questions have already been, some of them already been answered. The first one, should government seek external support? When we say yes, but not to use it in the way Nuvunga is just being talking about, meaning that transferring the burden of COVID through debt from this generation also to the next generation. And that will have a spiral effect on how society operates. Then there is an issue of gender and government, and whether, because in New Zealand, of course, it is a woman doing very well. The Germans also are doing very well, and others. I think it is important to have that dimension. The question is the gender of power. What is the gender of power? So the question can have 2 lines, that in the world in which we live today, gender has power. And we see it very clearly in the Human Development Report, particularly when you look at women representation in public office and so on and so forth, and in parliaments and all of that. That gives gender a particular dimension. But also the relationship between gender and power, both domestically and nationally, going back to the origin of the state. It does lend itself to the fact that an alternative narrative about this relationship between gender development and power, I think we should take it very seriously. And not only a matter of women representation, because one would see that women in position of leadership, their concerns are much more women societal oriented than, for instance, being interested in issues of oppression and so on and so forth. But also we have to be very careful not to make this idea of gender and power a discourse that can also be subverted and co-opted by certain political forces that would bring only the women whose gender it does not necessarily serve women issues or broader gender issues. But I think the observation is correct. Countries, as we are speaking today, countries governed by women are doing better than the other countries. This, of course, should give us. And this will take me back to the point that Professor Mali started this. And that is the issue of trust and governance. Because to me, issues of not governability, the impossibility of governability is always heightened when there is no trust between the governed and the governor. And this again reflects very much on the very nature of the state. It is a predatory state. In the past, we talk about predatory state, the state that predate on its own people. But now we see the state not only predate on its own people, but also on external sources, like the case of Mozambique that we just have, whereby under the cover of this new humanitarianism, I call it COVID humanitarianism, where international institutions easily give money because it is COVID. And it's not money that is going in the production. It's not going in production in any way, not even going into in defeating the enemy, that is COVID, through improving the health service, having better public awareness about it, coming with very creative ways of how people can assemble and at the same time observe distancing and all of that, and using masks and all of these issues. So it boils down a predatory state, a captured state, and through that capturing, of course, the capturing of the whole gambit of democratic rights of citizens. I think the point that just being mentioned, linked with the issue of trust and governance, together with the issue of captured state and captured democracy, also very much questions our own democracies. Of course, some people call them thin democracies, and of course, captured democracies. Some gives them all different kind of, but it seems to me we are still dealing only with, we are dealing with a form of democracy, not with the substance of democracy. And that is why I think that let us use this COVID disaster in a way to try to engender and to augur the issue of democratization. Because I think many of us think that democratization is finished. It is not. In fact, we are still democratizing. I don't think that we have reached a level where we can say today we are governed by democratic states. Wherever you go, even if those who portray all the semblances of democracy, if you scratch a little bit over this thin skin, underneath it you find very many authoritarian practices, where democracy itself, of course, can be used as an instrument of oppression in these societies. I stop here. Thank you very much, Helena.
Thank you, Dr. Professor. I think you have addressed all the questions. I'll pass it over to you, Dr. Malunga, to add.
Thank you very much. I completely associate myself with the responses of Professor there. I just want to address there were 2 points, maybe 3 quickly. So COVID and corruption, is COVID a miracle to governments for corruption? Absolutely. It's almost as if their prayers have been answered. It's funny how God works for the people that he shouldn't be working sometimes. This COVID is a godsend to our authoritarian regimes. And I thought so before I heard Adriano explain what happened to $500 million in 3 months, because we've had the same thing. We've had health systems that they destroyed. And then they're running now to the rest of the world to say, oh, please help us. Our people are going to die because our health systems are not ready for COVID. And the world says, no, we don't trust you. You are thieves. But since your people are going to die, here's a little bit of money. And then they eat that money again. So it's almost so fascinating how COVID is just this miracle, this golden goose. And now now it then brings me to the point where some of us start to campaign against our governments being given money for COVID. And then we seem as if we are unpatriotic. It seems as if we are not Pan-African. We want our people to die. But we know very well none of that money is going anywhere near our people. Right now, Adriano, you talked about Mozambique. I can tell you about Zimbabwe. We were told there were all sorts of equipment sent from Jack Ma. We were told there's PPE for nurses. The nurses are not in hospital. They are not in hospitals. They are not working. They are on strike because there is no PPE. If in Zimbabwe you get sick right now, you go to a hospital with COVID, there is no nurse. There is no doctor because the nurses cannot go there without any of the equipment. Yet the government has been given external support. It has been given money for PPE for nurses. It has been given money to improve hospital facilities and infrastructure. But 6 months down the line, remember COVID has been with us for more than 6 months now. They've had 6 whole months to do absolutely nothing. They've done nothing. The health system is exactly what it was, if not even worse than what it was before. Even their own comrades, ministers are dying in their cars because they cannot access health facility. Can you imagine such idiocy and foolishness? You even eat the money that will save you. So that is where we are with these people. COVID, yes, is a complete opportunity for them, and they should not be given any penny. And I repeat, they should not be given even 1 penny. If there is a way to go around our governments to help our people, that's what we should do. And they even hate civil society even more for it, because they now know that civil society is getting the money. If there's a way to get the PPE to the nurses directly, that's what we should do. If there is a way to get the hospital equipment right inside the hospital, in fact, they might even steal it and take it to their houses and sell it for their private clinics as well. This is the problem we have. We have thieves running our countries. So the second point, how do we fight back against repressive governments? We must just fight back. There should be no debate about whether the government has a right to restrict your rights in a way that you don't feel is justified. If the restriction is unjustified, you must resist it. Full stop. Our people must resist any excessive restriction of their rights. The only way to defend your right is to defend your right. Is not to ask for permission to defend your right. The oppressor has never helped the oppressed, ever in any part of history. The people must understand that if we are told that I cannot protest, somebody must explain how protesting, following social distance, wearing a mask, doing everything that is required is not acceptable. You must never just say, COVID, no protest, I'm sitting at home. No way. We need to conscientize our population to continue to resist these excesses by our governments. And we need to support our population to resist. So organizations like Adriano, conscientization, social awareness, is it necessary? We need to be pushing our governments to justify their policies, their laws, their actions. They have to do that, because if they don't do that, they get away with murder, almost literally anyway. So that's what I would say in closing for me, that this is a time to increase the pushback against authoritarianism. This is the time. So part of the COVID support externally must be to support citizens to defend the democratic space. We need to be framing the COVID response in a different way. This is the time to increase the support for democratic governance in our continent. So whether it is external, whether it is internal, the mobilization and the organizations against tyranny should actually now be increased, because we are in mortal danger of slipping back to a point where we might not come back. This is the point. Thank you.
Thank you.
Thank you so much, Dr. Malunga. Before you close it all together, I understand that OSISA has a funding line for COVID-19. Can you just talk a little bit about that? I've seen it in your website. There is a funding specific for COVID-19 that organization may access. Yes.
Absolutely, absolutely. So when COVID came, we also thought, oh God, this is a medical crisis. But we quickly realized, oh no, it is not. So our initial support was around saving lives, buying equipment, buying PPE for nurses, training healthcare, sanitizer, and all these things. That was our initial instinctive response. But when we quickly realized how governments were responding, we said, oh no, this is bigger. We then realized that we needed to provide more support to citizens in our countries to defend the democratic space, because the democratic space came quickly under attack under the guise of COVID. So that's one of the areas that we support. We then realized that during COVID, there were serious violations of human rights. So we said, wait a minute, we need to support human rights groups in countries. We need to support lawyers to defend human rights. We need to support lawyers to challenge unconstitutional and provisions and policies that violate human rights. We say we need to increase our support to making sure societies remain open. That's what we decided to do. And then we also realized that what then happened with lockdowns and so on, there was a huge economic contagion. You know, people lost their jobs. People could not go and fend. So we said, wait, we also need to invest in ameliorating the economic impact of COVID. That's another area that we support. And then, of course, we then also realized that there are geopolitical issues around COVID. There are debt issues. Our governments are using COVID to get money, which they steal. We said, well, we need to invest in watching this debt issue. But we also need to also invest in pushing for reform in the Bretton Woods institutions. We want them to forgive the debt that we already owe, because we owe a lot of money anyway, and we are in no position to pay. With our economies now severely impacted by COVID, we need to be campaigning for debt relief, not even debt relief, debt cancellation. So there's a whole range of things that we are supporting, and of course, including immediate humanitarian issues. So we found ourselves, even as open society foundations, engaging in the humanitarian, because this was also a humanitarian crisis. It wasn't only just a governance or policy or other crisis. Our support, you can go to www.osisa.org, and you'll find a whole range of information about what we do. The Open Society Foundation decided to allocate about $130 million globally for COVID. And of course, as you know, that in the network, OSISA is the network that is the foundation that supports this open society in Southern Africa. So we remain very invested and very committed to defending the democratic space, to making sure that governments respect human rights, to making sure citizens have agency, but to making sure that we fight and successfully defeat COVID. Thank you.
Thank you so much. We have about 6 minutes to go. We have 3 questions that are Mozambican related. One of them is completely, well, it's very broad, but one of them you just responded a bit, Dr. Malunga, and it was also responded by the professor, what the civil society organization must do. So I will not give it to you to respond to this. And there was another one related to the cost of corruption, and somehow there is some of the hints that you gave when you were intervening. So this is also somehow responded to. So before I give it to Professor Mohamed Salih, I'll just give it briefly to Adriano. Adriano, you have 2 minutes before I give it to Professor. Thank you.
Thank you very much, Helena. The question is whether Mozambique is a collapsed state. Well, this is a difficult question because Professor Mohamed Salih, he was the person who taught me political science, and he was my PhD supervisor. So when you have your PhD supervisor, the panel, you're in a difficult situation, conceptually speaking. But I mean, Mozambique is not a collapsed state, but it's a collapsing state. It's a collapsing state. If you look at the key functions of a government, and particularly how the political elite are using public resources and their attitude towards public resources, you will clearly see an extractivism mentality from the Mozambican elite. Extractivism. The $2 billion scandal, it epitomizes how extractivist these people are vis-a-vis public resources, including, more worryingly, the right of the future generations to benefit of this wealth that Mozambique has today. So they went so far to illegally, let me put it this way, to go borrowing outside the framework of the Constitution, simply because they were the liberators. They were the one who claimed to have built the nature, the state, the nation, and they claimed its political economy. So they are above, although there is a constitution, they claim to be above. They set the boundaries of what is allowed, what is not allowed. Therefore, they could go and do that. So this mentality, and when you see how, at some extent, the IMF position itself, when it comes to Mozambique, the IMF is soft, and you wonder why. So this it gives you a sense of an elite comprador, and a country that is governed by an elite comprador. That country is moving worryingly in a collapsing direction. I'll leave it there.
Thank you so much, Adriano. We are running out of time. Professor, please.
I think first of all, I would like to thank the Center for Democracy and Development, to thank you, Helena, and to thank also Dr. Malunga and Adriano. Adriano, of course, he's my brother. In fact, according to his late father, I am his father also. So I think the idea is Mozambique a collapsed state. I agree with you, Novunga. It is not. It is failed state. The state has 5 major functions. I think that every state in the world has failures in some of them. And I think Mozambique has its failures also, like other states. And this is something very particular in what you call liberation movement governments, whether it is Mozambique or Zimbabwe or Rwanda, South Africa, Namibia, Botswana, Tanzania also, Uganda, for that matter, Ethiopia, and all of that. The central question for these countries is that, does liberation brings liberty? No, because there is a contradiction between liberation and liberty, or liberation and democracy. Liberation is extra constitutional from the old framework within which people resisted the regime. Liberty is about giving people their rights, even to choose governments other than those who liberated the people. So you can liberate people from colonialism, but does not mean that you are bringing liberty to the individual person. And throughout the history of our continent, that has been the situation. We bring liberation, but we do not bring liberty. And that is why these governments, by the way, are very, very difficult to democratize. And they always have the tendency of falling back on their own extra-constitutional aspects. Of course, if you want if the enemy is attacking you, you do not have time, for consultation and democratic rights. Shall we attack or not? No. You give commands, and that mentality of commands has not changed in many of these leaders. And they think that the nation's debt to them is infinite. Even when they die, they are the fathers of the nation. They are this, they are this, they are that. Yeah? So that tension between liberation and liberty is very, very strong. It's the same between democracy and liberation. Liberation is a value, of course. You need social movements when you are not satisfied with, or when institutionalized politics cannot accommodate and solve the pressing problems of society. So that moment in history of liberation, that moment is necessary and important. The big question is, what is after liberation? And that is liberty. That is the individual's liberty to become free citizens. Just to be consulted when there is COVID taking place, and you get out the legal document from parliament, and there is no indefinite. I know many countries, by the way, not only Zimbabwe, many countries in Africa now, they have indefinite curfews. And they said the election will not take place until COVID is over. So I think that is it's a state failure. It is there. But of course, state failure is one state before state collapse. And no state, in fact, is immune from that, because the state failure also is a sign of state fragility. I think I stop here. Thank you very much, Helena. Thank you all.
Thank you so much, Professor. Thank you, Dr. Malunga. Thank you, Adriano. Thank you, participants, for your questions. I'm sorry that some of your questions, I think we have 3 questions that were left unanswered, but other opportunities will come. I'm sorry for the 3 minutes overboard. So I think we can stop here, and I wish we meet again for these debates that are very timely. Thank you so much.
Thank you.
Thank you. Bye-bye.
Thank you very much.
Bye-bye.
Bye, Professor. Bye. Bye, Adriano, Doc. Bye, Dr. Helena.
Bye. Bye-bye.
Bye-bye.
Bye.